Hey everyone, this is Paul from Ortho Eval. I have with me Erlen, and Erlen is 54 years old, and he has pain in his shoulder. What I want to talk about today are the most common signs and symptoms of shoulder arthritis. Now, Erlen, you've had this for a long time,
Yes.
right? Okay, and you've had multiple injuries to your shoulder when you were younger, and now your shoulder pretty much hurts all the time, okay? When you're sleeping, when you're working, and you've lost function in it also, okay? So when we look at shoulders that are arthritic, we need to think, does he also have a frozen shoulder, and or vice versa? So here we have classic signs and symptoms of a arthritic shoulder. So the first thing I'm going to do is I'm going to ask you to lift your arm up. Okay, you can see all the compensation, about 95 degrees of motion. He's really lifting with the shoulder here and back down. Could you lift your arm out to the side? Very limited there, and back down. Could you reach up for your head? And now could you reach down and behind your back? Okay, so you really can't internally rotate that arm either. So in order to identify if it's arthritis, what I do is I take a look at how well I can move him, okay? I can't get him any higher than what he did on his own a while ago. It's just jammed right up, okay? And we're gonna let that arm down. I'm gonna try to bring it out to the side. And as I do, the shoulder blade starts to come out right away. The other thing I noticed is that without having him take his shirt off is that he has a lot of atrophy. So the muscles are smaller around the back side of the shoulder where his rotator cuff is. And because he's not utilizing that arm out here, these muscles have become smaller and are just not functioning as well. The other thing that distinguishes a arthritic shoulder from a frozen shoulder is that the shoulder is very noisy. Okay, so when we move it around, it gets clunky, and you get these little sharp spots and you kind of bounce over it, and then you can get a little bit further. But that's another classic sign of having shoulder arthritis. Really, at this stage, with this much loss of motion, we might be able to gain a little bit in therapy, but ultimately he's going to need a total shoulder replacement, and to get rid of that arthritic joint, get a nice new one in there, start to work on, more function, more motion, and less pain overall. But thank you, Erlen, for demonstrating your shoulder today, and hope you all enjoyed today's video. Thanks.